Hi, I'm Jess Trengove, Olympic athlete, physiotherapist and mum. It's in everyone's interest to be fit, well and living their best life, whether that be as a professional athlete, striving to reach his or her best performance, or as a parent who wants to be healthy, active and keeping on top of a demanding work and family life. As an elite athlete and a physio, I've witnessed both sides of the physio table and know how much of a positive impact physio has on the well-being of so many people. Physio not only works, but it delivers much needed financial savings to the health system.
Hi everyone, I'm Scott Willis, National President of the Australian Physiotherapy Association, standing here in Tasmania, the land of the Palawan people. The Australian Physiotherapy Association, or the APA, is 29,000 members strong. We've come out of a very unsettling past 12 months in great position. We've advocated hard for our members during this time. We are committed to our members, their career success and the professional development, as well as the profession overall, ensuring better patient outcomes and quality of life for all Australians. Our vision is to ensure that the community recognises the benefit of physiotherapy and that all Australians have access to physiotherapy to optimise their health and well-being. Our desire is to leverage our global leadership position for the benefit of physiotherapists and their consumers. The importance of high quality healthcare and of physiotherapy specifically has been highlighted during the COVID-19 pandemic. Throughout the course of the pandemic, physiotherapy has been considered an essential service, underlining how critical physiotherapy treatment can be to people's well-being. Physiotherapy has the power to enhance quality of life, improve health outcomes and offer best value for money in the allocation of scarce resources. We are very proud to be able to sponsor today's event and are excited to be here to walk you through our economic value of physiotherapy in Australia report. As a profession, the health benefits, the effectiveness and the value we provide to the healthcare sector is proven in the research literature. However, despite the strong scientific evidence base, we lacked a high quality study examining both the effectiveness and the economic benefit that physiotherapy provides. The economic value of physiotherapy in Australia report is that missing link to demonstrate that physiotherapy treatments are clinically effective and deliver net economic benefits with improvements in the quality of life experienced by our patients.
Physiotherapy is cost-effective, evidence-based healthcare. It's hard to put a price tag on quality of life. Health and well-being really are priceless. But with finite levels of funding in our health system, it's important to determine the economic value physiotherapy provides. We have defined our value in costs against benefits to show the true value of our interventions.
Hello, I'm Simon Tatz. I'm the General Manager of Policy and Government Relations for the Australian Physiotherapy Association. Last year we went to the Nous Group, one of the leading consultancies in health in Australia, and we asked them to give us the evidence base for physiotherapy interventions across 11 different areas. This is the first time it's ever been done in Australia, and we understand one of the first times it's been done in the world. No one has really produced the kind of evidence based on the cost savings of physiotherapy interventions. It's a landmark and groundbreaking report which we launched earlier this year. It's called Value of Physiotherapy in Australia from the APA and the Nous Group. What Nous did was they took a vast amount of existing data and put in a series of inputs which included the cost of treatment, the number of treatments, the amount of time you'd take to go for a particular treatment, other costs associated, equipment and others. They fed it through their complicated algorithms and formulas and came up with a net benefit of physiotherapy across 11 interventions. And some of these 11 interventions include stress urinary incontinence, Parkinson's disease, chronic neck pain, emergency department services, back pain, most importantly, falls prevention. The report came out earlier this year and the APA has been using it to talk to members of parliament, departments of health, funders, PHNs and others involved in the health system, because for the first time we actually have an evidence-based economic report that shows how physiotherapy values the patient experience, the patient outcomes, but also saves money across the health system. We know it's a hard journey getting reform in the Australian healthcare system. We have a structure that's worked well, it's the envy of the world. Getting change and getting governments to reform the way they fund things isn't always easy. But what we have now is evidence that shows the value to the government in terms of saving money to PHNs and others, but also the value to the patient experience by having these physiotherapy-led interventions. As I said at the start, this is being picked up overseas. We've had quite a lot of interest because it hasn't actually been done, oddly enough, around the world, looking at the economic base rather than just what we know and what physiotherapists know is that their interventions work. They're better for patients, they have better outcomes, they save people unnecessary surgery, and in the area of falls prevention, we know save lives and serious injury. The report's only been out a few months. Our task at the APA now is to advocate on the basis of this, work with governments, work with funders, work with decision makers to get them to start to reform the health system and invest in what works. That's the basis of the Australian health system, investment in measures that are cost effective, efficient and actually in the patient's best interests. We now have 11 examples across physiotherapy. We may do more in the future. But for the first time, we're very proud that we can actually match what we know, what physiotherapists know in terms of the work they do, with an economic argument to try to reform the health system to produce better outcomes for everyone involved.
Thank you, Simon. This report will help to inform our strategy as we continue to drive and enhance our advocacy efforts. It allows us to back up what we've been saying for many years now with hard proof that evidence that the physiotherapy is incredibly effective. It allows us to put forward the strongest case for reforming the healthcare system. Two of the interventions assessed in this report that will interest you is orthopaedic outpatient services and physiotherapy as an effective treatment for osteoarthritis of the hip and knee. It focuses on the scarcity of hospital services and the impact on the healthcare system of patients utilising surgery over conservative interventions. As many as 80% of patients referred to orthopaedic outpatient services can be managed without surgery, with physiotherapy being a cost-effective option for rehabilitation. Likewise, physiotherapy treatment for the osteoarthritis of the hip and knee can not only reduce pain, dysfunction and improve quality of life, but it can save thousands of dollars per episode and significantly reduce public waiting lists and value add to the overall health system. The report highlights the higher quality of life that patients can experience during their recovery when undertaking physiotherapy. This is so important to us and our members, as it not only means that patients are put under less financial stress, but could also recover more quickly. All of this brings me back to one of my first points. The physiotherapy profession, the APA and our members work together to bring the highest quality of care to all Australians. The report confirms this tenfold and provides evidence that physiotherapy is effective, both in terms of treatment and cost savings. Physio is part of the health journey for many people, helping them back to doing what they love. Thank you for having me here today, and I wish you all the very best.
The evidence for physio outlined in the report is conclusive. If the health system used physio treatment options instead of other more costly treatments, many Australians living with one of these 11 conditions would be experiencing better health. Furthermore, the health system cost savings would be in the millions of dollars, meaning that it's a big win for all of us. My hope is that these findings lead to increased access to physiotherapy for all Australians in our public health system.